This video is based on a chapter from the book Mazha Madhumeh Mazhe Niyantran. For more details, you can visit www.schoolfordiabetes.in.
Hello and welcome. Today, we're going to pull back the curtain on the world of diabetes testing. We're going to talk about the why behind every test and the how of what they tell us, also you can feel more empowered on your health journey.
You know, it's a question I'm sure many of us have asked. You go to the doctor's office, and suddenly you're handed this long list of tests. It can feel a bit overwhelming, maybe even a little unnecessary. But what if I told you that every single one of those tests is a crucial piece of a puzzle? Well, today we're going to put that puzzle together.
All right, so here's our game plan. We'll start with why we even need these tests, then get into exactly how diabetes is diagnosed and, importantly, how you can measure your control. We'll also look at some key tests that go beyond just sugar, and we'll wrap up with the most important part, your role in all of this. Okay, let's dive right into our first section. At its very core, testing is simply how a doctor gathers the evidence they need to make the absolute best decisions for your health.
Think about it like this. There are really two kinds of exams. First, you've got the clinical exam. That's what your doctor does in the office. They're observing, asking you questions, using their basic tools. This gives them an initial idea, an educated guess of what might be going on. But to confirm that guess and build a really precise treatment plan, they need hard evidence. And that's exactly where laboratory tests come in. They give the solid data to go from just a suspicion to total certainty.
So how does this all work when it comes to diagnosing diabetes? Well, it all boils down to one key measurement: how much sugar is in your blood. The first really important number is your fasting blood sugar. This is done after at least 8 hours without any food. Your stomach's empty, and all the sugar from your last meal is absorbed. What's left? Well, this test shows your body's baseline glucose level. You'll hear a lot of doctors say, fix fasting first, because getting this baseline number under control is, the foundation for everything else. Now, while the goal is to control high sugar, it is absolutely critical to avoid overcorrecting. When your sugar level drops too low, that's a condition called hypoglycemia. It gets dangerous fast. As you can see here, the symptoms really escalate. Below 65, you might feel dizzy. Then below 60, your body's alarm bells start ringing. You get sweating, a rapid heartbeat, and by the time it drops below 50, the risk of fainting is incredibly high. This is exactly why that regular monitoring is so important. Okay, next up is the postprandial or PP sugar test. This one measures your blood glucose exactly 2 hours after you've had a meal. See, this isn't about your baseline anymore. This is all about seeing how well your body's insulin steps up to the challenge of processing the carbs from your food. So, what do all these numbers mean? This chart lays it out really clearly. For your fasting sugar, a level over 125 is the line for diabetes. For your post-meal sugar, it's any reading over 200. Now, those numbers in between, they show an increased risk, what we often call pre-diabetes, and that's such a critical time to take action.
While testing after a meal is useful, it can be a little inconsistent, right? Did you eat a lot of rice? Was it a stressful day? So to get the most accurate, the most definitive diagnosis, doctors use what's called the oral glucose tolerance test, or OGDT. By having you drink a very specific 75-gram glucose solution, they take all the guesswork out of it. It standardizes the test and gives a true measure of how your body responds to glucose.
Okay, so a diagnosis has been made. But how do you and your doctor keep track of your progress over the long haul? This is where we need to look beyond just one-day measurements. The single most important test for long-term control is the HbA1c. And the science behind it is pretty cool, actually. Sugar in your blood has this natural tendency to stick to hemoglobin, which is a protein inside your red blood cells. Now, since those cells live for about 3 months, measuring how much sugar is stuck to them gives us a really reliable average of your blood sugar over that whole period. It's kind of like getting a report card for the last 3 months.
Just 1%. I mean, it seems like such a tiny number, doesn't it? But a huge groundbreaking study called the UKPDS found that reducing your HbA1c by just this small amount has a massive, life-changing impact on your long-term health.
And this chart just shows how powerful that 1% really is. A 1% drop in your HbA1c can slash your risk of kidney failure by 37%. Your risk of amputation, that goes down by an incredible 43%. And your risk of a heart attack, down by 14%. This is why consistent control, the kind that the HbA1c measures, is truly the name of the game. You know, managing diabetes, well, isn't just about watching your sugar levels. It's about protecting your entire body from potential problems down the road. And that means we need to look at a few other things.
A really key annual test is the lipid profile, which is just a fancy way of saying it measures the fats in your blood. This looks at your total cholesterol, the bad LDL cholesterol that can clog up your arteries, the good HDL cholesterol that helps clear them out, and another fat called triglycerides. Keeping all these numbers in their target ranges is so important because high levels can harden your arteries, which seriously increases the risk of heart attack and stroke.
And beyond fats, there are other yearly tests that act like a defense system for your body. The UMA test checks your urine for tiny bits of protein, which is one of the earliest warning signs of kidney damage. An ECG, of course, monitors your heart. And a really thorough blood pressure check, and I mean taken while you're lying down, sitting, and standing, can help detect a subtle but serious complication called autonomic nerve damage.
We've talked about a lot of tests, but this last section, this is probably the most important one. It's all about shifting our mindset and realizing the power that we all have. So let's try to reframe how we think about all these tests. They aren't just a burden for you to get through, they are essential tools for your doctor. The results from these tests guide every single decision, which medicine to use, the exact dose, when you should take it. Really, these tests are the blueprint your doctor uses to build a plan that's going to protect your future.
And this brings us to a really clear, simple call to action. You can't feel diabetes in its early stages. There are no obvious symptoms for most people. The only way to know for sure is through a blood test. That's why the advice is so straightforward. Every single person over the age of 35 should probably get their blood sugar checked once a year.
The urgency here really can't be overstated. The source material we're drawing from describes the rise of diabetes in India as a slow-moving tsunami. Think about that. Projections are showing that by 2025, 1 in every 5 people could be affected. When you're facing a wave that big, our single best defense is to see it coming. It's early detection.
Look, understanding these tests is the first big step. It changes you from being a passive patient into an active, empowered partner in your own health. The knowledge is officially in your hands now. The only question left is, are you ready to use it?